paternalism, the definition of paternalism is to do something with or without your permission for your own good. And doing something for your own good is really valuable in lots of contexts. We often think paternalism, people sometimes think paternalism is okay when we're dealing with children. They want to eat nothing but candy. I think they should sometimes have a vegetable in their diet, right? So their preferences maybe don't reflect what's in their best interest. And in those cases, sometimes I go against their preferences. The reason why I struggled with the word paternalism in this context, and I do, like you say, use it to describe what's going on, is because doctors will, they will sometimes describe their actions in this way. They will say, you need a pelvic exam at certain intervals. I don't think you're going to get it at the intervals that you should. And so I'm going to force you to get it at the interval at higher rates so that, by tying it to this unrelated procedure. And this will be overall in your benefit because Pap tests have saved so many lives. Literally, catching cervical cancer early can be a huge lifesaver for so many people. But now let me switch to my struggle. I mean, if it was truly paternalistic, in the best case scenario, the tests are in the patient's best interest. And when I delved down into this issue, I found they are not in the patient's best interest. They are happening at so high a frequency that they are leading to false positives. They are causing pain and suffering. They are causing costs, right? Women make up a pretty big portion of our hourly wage workers in the United States. So going to a doctor's appointment is not nothing. You are foregoing wages during that time. Not all US counties have an OBGYN. How far are they driving? And so the more harms that we uncover as we look at these tests being implemented on patients at too high a frequency, or in the wrong way with the wrong motivation, the more it seems like, hey, wait a minute, this isn't even in my best interest. And now it looks like a form of control. And that's why I start using this term medical sexism, which is a power hierarchy. That's why I start using terms like getting compliance. That's why I start talking about healthcare advances for women and people associated with women being weaponized to use against them. There's more going on here for precisely the reason that it sadly is not in our best interest all the time to get these tests in this way or at these intervals or tied to these drugs. It doesn't help us.